is your life. Don't let it be clubbed into dank submission. There is a light somewhere. It may not be much light, but it beats the darkness. He can't beat death, but he can beat death in life sometimes. And the more often you learn to do it, the more light there will be.
So I think we're living through a 21st century where we've got scientific innovation that is able to create the types of medicines that I think we all hope for, envisioned.
Biotechnology is all about innovation, and we lead the world in it. We are producing drugs faster than the rest of the world combined, and the pace is accelerating. It's about starting with one molecule, seeing with one scientist who's maybe had one conversation, and they come up with one treatment, and they start one brand new company, and it starts with one patient, and that's where the hope comes from.
My name is Alex Denker. I'm a Fabry's patient. I am the first person to use Galafold with this chaperone technology.
My name is Mike. I realized I was one of the first people to benefit from an RNAi therapy that is pioneered by Alnylam Pharmaceuticals.
My name's Edward Papiro. I'm a father of 3.
I'm Kristen Papiro.
You know, being the first one, you know, you have to make a lot of sacrifices.
For me, it was, I'd never been sick in my life. In high school, I never missed a day. I was never sick. I would never broke a bone, never been to the doctors ever my whole life. And then at the age of 29, I started feeling kind of funny.
So one summer, my family and I were on a family vacation, and all of a sudden we were at a ball game, which we enjoyed going to, and I started having numbness in my fingers, and my hands would go numb.
So when Anthony was born, we noticed that about 2 months old that he was constantly staring at light. He would stare at lamps, he would stare directly into the sun. We weren't really sure what was going on.
His eyes would kind of just roll back into his head, constantly staring at the light, always searching. Definitely something different as far as the need for extremely bright light, the willingness to stare directly into the sun. It was odd.
Took us about 9 months to find an ophthalmologist who told us that this is really rare, but we believe your son has this condition called Leber's congenital amaurosis, or LCA, and we'd like you to see the genetic ophthalmics team up at Children's Hospital of Philadelphia. So with Nicholas, you know, we didn't know when he was born whether he would have it or not. He was about 2 to 3 months old. I went into his room to get him out of the bassinet, and he was staring out of the window and had that same vertical nystagmus that Anthony had almost out of nowhere. And I remember backing away as if I didn't see it, you know, thinking, I didn't just see that, you know, this is not happening a second time. So at 4 years and 6 months old, we had 2 children diagnosed with LCA.
My situation kept getting worse and worse and worse, and they put me on all kinds of painkillers, you know, anti-epileptic, you know, small fiber peripheral neuropathy type medications, and nothing helped. So it was basically 5 years total of being undiagnosed. I was deficient. The enzyme wasn't working properly.
ATTR amyloidosis is a disease that is genetic. My father was diagnosed with the disease. The doctor told me that my genetic test for amyloidosis had come back gene positive, the same gene that my dad had.
The ultimate, it starts with one, for all of us, is to see the transformational effect that novel therapies can have for a patient.
They told us when Anthony was diagnosed that they were already in animal trials with gene therapy. They had taken dogs with LCA and injected this DNA into their eyes, and they were showing improvement.
So I was diagnosed in the fall of 2003, but in January of 2006, I took the first pill, Galafold. So it actually takes the enzyme that I already have, makes it whole, if you will, makes it properly shaped, and guess what? Now I'm got my life back.
So once I started on Onpattro, about 3 or 4 months into that, I started seeing the benefits. The numbness and tingling had gone away.
It was actually in the middle of the night. I just happened to be laying in bed at night and scrolling through the phone, and it's funny, I read the article, FDA approves drug for gene therapy surgery, and I thought, this isn't true. I'd say it was about 2 to 3 days after the second eye, and he just sort of stopped and looked at me in this way that he had never really looked at me before. And I said, honey, what are you looking at? And he said, you.
He was playing baseball with his cousins. He could never even see that. And the ball was coming in and he's just smacking it.
For Anthony to be able to have that improvement and be able to sort of open the door for his brother, I don't know that they have any idea of what they share.
I feel pretty good now. I'm 50. I feel better now when I'm 50 than I did when I was 30.
I'm living a miracle. Like in one lifetime, they told me that my children would go blind, and in the same lifetime, I seen that diagnosis erased.
5 years ago, my dad passed away with no treatment options available to him other than a liver transplant. Now, with Onpattro, treatment is available for patients, and they don't have to think about a major organ transplant to give them any type of hope.
And it's been remarkable.
It doesn't feel right to be able to produce these new cures and treatments just for some people. Not only in this country, but around the world. We want everyone to have access to these drugs.
And so in some ways, we're living in an age of Star Trek medicines with Flintstone's payment and reimbursement system. And we really need to upgrade that system to match what's possible in the 21st century and what's possible from the science that's going on in all the research labs. And by and large, our healthcare system has rewarded and is set up to incentivize and pay for more treatments, more lab tests, more visits. Where science is moving is towards a world where you can envision a single dose or limited dose treatments that ultimately deliver better health for patients. And that's ultimately what we should be incentivized for.
Financially, what's it going to cost you to support a child that cannot see over the course of a lifetime? Isn't that bad health? He's going to do 80, 85 years visually impaired. He's going to need assistance the entire time. So I think it's a drop in the bucket. I think that if you have the opportunity to fix something and you don't, that's a sin. So until it's a problem in your house, you may have an opinion on it. And I believe that you're entitled to that, whatever your opinion may be. But if you just want to do no gray area, all black and white, just look at it dollar for dollar. It's very expensive for a Braille teacher, for occupational therapy, for a ride everywhere for the rest of your life. So now we have had a treatment given to my sons that will hopefully grant them their independence. Just looking at it from a financial standpoint, it's a hell of a drug.
I can only imagine what the future holds for patients like me.
That's what it's all about, is making those changes right there.
I'm almost more excited about the unknown, the person who's the underdog, rising to great success.
You cannot put a price on that.
That concept of being knocked down on the mat, but being able to constantly get up when people assume that was just not possible anymore, rings true.